Good morning, everyone. I'd like to welcome you to day 2 of the workshop on exploring shared value in global health and safety, both those in the room and those who are joining us via webcast. We'd like to kick off day 2 of the workshop by welcoming Dr. Victor Dzau as our first speaker. Dr. Dzau is the president of the National Academy of Medicine, formerly the Institute of Medicine, or the IOM. He also serves as chair of the IOM Division Committee of the National Academies of Sciences, Engineering, and Medicine, and he is Chancellor Emeritus and James B. Duke Professor of Medicine at Duke University, and the past president and CEO of the Duke University Health System. Dr. Dzau?
Well, good morning and welcome. This is, to me, a very important topic. I don't mean the conflict itself, which is important, but your overall forum, which in fact looks at public-private partnership. As you hear from my remarks, I think that, to me, a really important solution to many of the aspirations and challenges that we see in global health has to come through public-private partnership. And of course, because of that, the issue of conflict needs to be addressed. So I was, when my specialist came to me and said, Rachel wants you to talk about conflict of interest. She wants you to talk about your own personal experience at Duke, and you're on this corporate board. So I said, oh, okay. So I did my best to put together something, hopefully to engage you more in conversation than anything else. That being said, I usually don't use too many slides, but this time, actually, we did put some things that I think useful as an illustration of a number of issues that we should be addressing. Okay, so I think as you see in the third bullet, conflict of interest isn't intrinsically bad. It's a normal part of life. Why? Because, at least from my perspective, let's take healthcare. I'm a physician scientist, and I can tell you that I founded at least 2 companies in the work that I've done because I work on the bench, and I come up with this great idea of how one can actually develop therapeutics. And if you take it far enough, you know that you are right up against war. There's no way that you can actually have the capacity, the capability, the resources to get it through all these processes, at the end of which you have to scale to be able to have impact on patients. So how does actually someone can say, we don't really want to pay any attention to the commercial world because those resources are necessary and have the expertise of being able to bring those to bear. So in this slide simply says almost no good idea will affect significant patients if it isn't commercialized. Now, that's a strong statement, but that actually is a statement taken from a Duke. If you look up the Duke site about conflict of interest principles, that actually is what's articulated. Because I think we recognize as academics that, in fact, the real world is more than just academic. The real world is more than nonprofit. The real world is being able to work and take it to whatever that's good for the patient and for society. Now, we do need to manage the conflict. The reverse side would be pharmaceutical and device companies don't take care of patients, so they need advice from people who do. Or for that matter, they need advice from science, they need advice from implementation. And so how do you actually move important innovations and delivery opportunities, delivery of care, without having people to work together? I just don't know how one will be able to do it unless you do it in a very narrowly carved fashion. So I think the statement simply says that conflict isn't bad. One can cast, this is good, this is bad, this is a good player, that bad player. It's a normal part of life. But we're going to have to find ways to deal with it. And this is where the conflict interests come in. This slide, which I actually showed in, I think, your first meeting, I believe, Clarion, about public-private partnership, I actually adapted this because I was talking about my own experience in innovation. And this slide, which I've presented a number of places, shows you the roles of different partnership that can lead to, in this case, innovation, as I'll talk about later on. my interest in innovative care delivery systems that can be scaled and replicated, particularly globally. But here, I think I want you to look at only the concept that each component have different expertise to bring to the table. No one individual or one entity has sufficient expertise in one way to address issues of global significance. In academia, expertise, research education, business is know-how, is tremendous resource and capability to actually execute. NGOs to convene and implement many of the really important mission, and of course the government to enable, at the same time to regulate. And you don't have to look at the details of this particular slide, but the idea is it is what we have to do in global health and many other areas. So the question is, why is there, in fact, you spent yesterday talking about shared values, and of course everybody says, yeah, kumbaya, we want to do the same thing together, right? So why is it everybody so nervous about these things? Because I think there's certainly concern that by working, certainly from the nonprofit side with private companies, especially in the health sector, where there are many product PPOs, product-dependent PPOs or access PPOs, that by them participating, they are trying to seek future profits, markets, to control the agenda of international policies. And I take that as a quote because that's what's been written. And so many organizations, when they do form public-private partnership, if you accept the premise, I say, it's a good thing because you bring together the best resources to try to solve a common problem with a high-level mission. Then you have to deal with conflict of interest. Actually, even in this statement, I think it's a concern. It's a notion, and not always found in reality. Because I talk about my own experience that yes, I think when you look at corporations, at the end of the day, it is about shareholders. But corporations, I believe, can do good and do well. That is to say, they can actually look at helping to move the agenda forward and really not have any immediate financial benefit. But obviously, it also helps them to think through and understand the market, the challenges on the ground, where it makes them a better company, should they have new products, et cetera, to be bringing. I think that's quite acceptable from my perspective. But let's talk about that a little bit. So to talk about conflict, you have to talk about definition and criteria. And I take these from, of course, many different writings from, on conflicts. And also, if you go to any university, a site, you're going to have lots of things to read about conflict of interest. So it's been defined as involving set of conditions in which professional judgments concerning a primary interest, patient's welfare, validity of research, tends to be unduly influenced by secondary interests, such as financial gain. I think this is as good a definition as possible. Obviously, secondary interest doesn't always have financial gain. There can be many other reasons that you would do so, but unduly influenced by that secondary interest. Now, it's also important to separate between or acknowledge personal and institutional conflicts. Although they frequently overlap, they are different. And an institution such as IOM or Duke University or others, we look at decisions we make as an institution that in fact poses challenges with regards to relationship with many of you. And as you know, I'm sure we'll talk about that later, we put a lot of different hoops that you have to go through, and we have to go through to at least reduce the conflict in the institute level. At a personal level, where people have relationship and financial relationship with, say, the private sector, that's another issue. But someone like me, perhaps not in the current role, but in my last role, frequently has both personal and institution, because I am the institution as well in terms of making decisions in the institution. So we'll come back to that. Also, the issue of actual versus appearance. I think I hear, and I certainly have said it myself many times, really, there's no conflict. It's what it looks like to people. But I think it's important to recognize that the appearance of conflict, the perception, is actually very important. And you have to deal with it. And so, actually, in many ways, most institutions do not separate actual from appearance, simply because at the end of the day, where the criticism comes in is whether your influence was unduly influenced, your decision was unduly influenced by secondary gain, personal, or the appearance of that decision being influenced by that. Now, I think the question that we're going to be, I'm going to give you an example, of course, is, how do you assess conflict, and, how do you weigh the benefit versus the risk? Because I said at the very beginning, it's almost a way of life if you really want to move major agenda forward. And yet, how do you actually get it right? That is, if you see something in which the benefit outweigh the risk of conflict, can you actually go ahead and do it? And how do you quantitate it? That's a very difficult issue. Some institutions for personal conflict set just a dollar number, above which you need to report, below which you don't have to. Now, that's highly arbitrary. As many of you know, you're being influenced in so many different ways, whether it's $1, whether it's a pen that you get, versus whether you get $50,000. But that, in fact, is what we all have to make judgment that we have to do every day. So IOM had a report in 2009 that helps define the criteria of conflict. And as I said, I think the things that you have to think about, in particular, in terms of what poses a conflict, would be likelihood of undue influence. If you have a chance, you can read our report, which actually puts out the different questions that one should ask, whether, in fact, by entering this relationship, there's a likelihood of undue influence, and what's the likelihood. And the other one, of course, is seriousness of possible harm. At the end of the day, I think what we all are interested in is not only do no harm, but do good. So the question is, one has to make some judgment about what's this potential seriousness if some harm were to befall to the activity. So I looked up a few guidelines and procedures in a number of public-private partnerships, as an example. So the Global Alliance Gavi, the secretary actually hires an expert to actually address conflict. So you take it out and have some kind of compliance officer who look at the issue in terms of procurement and link the broader issues on conflict together. So some kind of independent, objective decision-making. Applies specific conflict issues to different partners. So all the partners are required to complete a conflict interest form when executing contracts and participating in meetings. Another one, PATH. PATH puts more on the value side for disclosure. Proactively disclosing if, in fact, your own interest. I think almost every company, every activities, most activities, and it should be good practice, even NGOs, to be able to say, annually we need to disclose any kind of report, any kind of conflict, any kind of financial relationship, but also as it develops. And also, particularly when informed decisions made by others, that you in fact understand and review your conflict. More importantly, training. There's not enough sufficient emphasis on training. Training not only staff, but training, in my opinion, your board, the people who oversee this. And I'll come back again to talk about this a little bit. External monitoring and also internal monitoring. And I'll have quite a lot of examples in this. So the question in terms of, if you bring them all together, these are the principles which was very well written by Omar Buali in this paper that says these are the elements when you try to address conflicts. Accountability and governance. And again, the accountability and governance is not only at the board level, but throughout the organization, of course. But boards have to be very much aware of and be part of the review of conflict and accountability. Acknowledgement and disclosure of possibility of conflict, as I said, perception and reality, both in terms of annual disclosure, but also when it comes up, when the event comes up in decision-making, which is the next point. Abstention and withdrawal from decision-making process, you recuse yourself from decision when, in fact, it is something that actually creates a conflict for you because you have a financial relationship of some sort, organizations in which they have a secondary interest, training, really important for employees, and I'll add that to that as well, not only employees, executives, and also the board of directors or trustees, public reporting, and creating an environment where people can be able to report concerns, obviously, under confidentiality, but also transparency of conflict of interest, and report instances of wrongdoing, and of course, finally, independent monitoring. So these are the very good practices of conflict, which you can address conflict of interest. So Rachel asked me to talk a little bit about my own experience, so I'm going to, for the rest of my comments, I'm going to talk about my own experience, and then we should really open up for conversation. So how did I deal with when I founded a NGO or 501c3 entity together with that receives funding and principally receives funding from industry, but to do global health mission? It's called IPIHD. I'll talk about that. How did I deal with personal conflict? I was the chancellor at Duke and the CEO. Obviously, I was responsible for over $4 billion revenue a year, and we're really the big elephant in the university. But there's so many decisions and interactions, of course, I made, with these issues in mind at Duke, and how do I deal with this at the NAM, IOM, and my current job. So I want to tell you about a really phenomenal experience I had at the World Economic Forum, and some years ago I was very active in it, and initially I was just leading a project, just asking about innovation in in health arena, and much of the discussion certainly years ago and not so now in the World Economic Forum was, of course, dominated by CEOs of pharma and device company that actually talks about innovation is how do you actually get more through the pipeline, and how do you develop innovation in many parts of the world. We brought the idea that, in fact, there's another set of important things that's needed to be considered, which is care delivery. Because if you look at the end of the world, care delivery is going to be the last mile by which you can really impact patients in terms of delivering the care that they need and improving health altogether. And so in many countries where the resources are very limited, what's going on in terms of the care delivery system? What we've discovered, I'll show you a slide on this here, is that by studying and curating the information, there are a huge amount of private sector innovation in care delivery, which is low cost and good quality. And that, in fact, if you imagine that these were to be implemented not only in these countries, India, Africa, many others, even the US, and you can scale replicate, that can actually be transformative. And many of you know, for example, Narayana Heart Institute, that's cardiac open heart surgery for $3,000 per surgery, and they've done it for 20 years. And they've learned how to do innovation in terms of frugal innovation, process innovation, bring technology into the equation, creating a culture of looking at no waste, and of course, engaging whole different ways. And I can give you lots of examples which I would not, and you guys know about this. But suffice to say that when we begin to look at this innovative network, we became so impressed by saying that, one thing we can do is to figure out a way to help them, these innovations to have much greater impact. To create an entity, initially it was really more of a project of a platform that support the growth of innovations to scaling and replication in successful healthcare delivery around the world. As they say, in these countries, invention is necessity is a mother of invention. So I think what we decided to do is to say, let's do that. And working with the World Economic Forum, with all the CEOs there, you can see that all these CEOs also get it, because you talked about yesterday about corporate social responsibility all the way to good business practice. It was not difficult for me to convince the major private sector leaders to have this discussion to support this idea. But the pitch I gave to them was, this is doing good and doing well. Because not only would you be able to help and scale up these great innovations that people can have access to, but let's face it, at the end of the day, companies need to find understanding of what's on the ground and how people tackle their many challenges in healthcare, and how innovators and care deliverers are tackling and what their challenges are. And in fact, if this is successful, then what you would have is channels by which your products can reach the population that you need, and driving down towards the bottom of the pyramid. Right? I don't talk about prices, I don't talk about those things, but I think my feeling is if you look at a high level of conceptualization, this is clearly good. And really, believe me, it was not difficult to get commitment. And so the way that we found the organization is we actually decided to create a separate organization to manage this. This is 501c3. We launched it actually at Davos a few years ago. Duke Medicine, myself, McKinsey, because they were the consultant to help us do a lot of this analysis, and the World Economic Forum. And so the idea was to say it's a separate organization. And we were challenged with the idea of what to do with it. And of course, many people have different, ideas of where to place it, what kind of people recruit. So one of the thoughts I had was, why not put it at Duke University? Because we have, in fact, the infrastructure, the capacity, the policies, the HR, everything already set up. So, in fact, we convinced and created a North Carolina 501c3 hosted by the Duke University. And of course, it receives support from and collaborates with diverse group of organizations. So I see GE in here, Medtronic, J&J, you name it, Novartis, we're all part of the support for this. But also we got money from Robert Wood Johnson Foundation, the Health Foundation of UK, and many others as well. So it really is a true multi-funder organization, although a good amount did come from the private sector. But the creation of this organization resulted us eventually to get a $20 million from USAID because of the tremendous, great idea of these social businesses that can not only be useful, we hosted at Duke for our students to learn and for them to participate, but also, of course, being able to move forward the agenda of social good. Now, we changed the name, by the way. If you look at the website, it's now called Innovation in Healthcare, and because IPIG was too long a word. So if you haven't looked at it, that's what it's called right now. Now, so how do you actually govern something like this? So as I said, it becomes a support corporation of Duke University. So with, in fact, the oversight by the Duke University Board of Trustees. It's one of the many support corporations that the university has. But we set a separate fiduciary board of directors approved by the Board of Trustees. And it really has the three co-founders of the IPIHD. In the case of World Economic Forum is Arnold Bernat, in fact, who is overseeing this. And of course, at McKinsey is Nico Keeney, who's the head of, Nico Henke, who's head of global health, and myself. And then we have 2-3 other members which are appointed by the trustees. What we did is we formed a management agreement with Duke University. So in which case, the people who work at the NGO are employees, so therefore we can take advantage of HR and all the policies and enable us to get going so much easier. So they manage all aspects of IPIHD, but the oversight and strategic direction, in fact, is the board, which is independent. Well, dependent as Duke appointed, but independent from the funders. So in other words, the funders have actually no direct decision-making, but we, in fact, created a board of advisors for the funders. so that actually on a regular basis, the funders are sending their people to get regular updates and give us advice, almost like a board, but they make note of fiduciary responsibility, and it's seen by the board of directors, as said. Now, this one is unique because we do not provide any product commercial relationship. We really facilitate at no gain. But I can tell you we've gone on all these directions. That is, we enable the companies to connect with without kind of facilitation or quote supervision, to connect with the innovators. After all, the innovators really need the support. Also, when we look at the innovators, they have 4 gaps. They have a financial gap, the value of death. Nice to scale to a certain level and show it works, but how do we get to the next level? So finance, they need to create business plan. They have frequently a knowledge gap in terms of how to build a strong business. They have regulatory gap, which the corporations are very helpful because they can bring in the people to give them advice. So what happened is the sponsors at the same time created a network, if you will, of support services advice for these innovators. And also we have held recently, the last couple of years, in fact, investors conference. We brought investors to come in and do pitching like what you see in Shark Tank, and it's really effective. And of course we help them, and we have very, very impressive numbers of how much money we've been able to raise for these innovators. So that's an example of what can be done in terms of really understanding that relationship, how to actually create the governance over it, and how to avoid direct financial conflicts. Now, at Duke University, where I played a role, we have very, very, very extensive conflict of interest regulation. And I just give you a bullet form of some of the things that we do. Policies and guidelines are very clearly articulated, reporting on an annual basis and disclosures. We have, in fact, the whole staff that will monitor this with the committee, and they actually not only look at the data you report, they validate it. I'll record and say, you know what we saw on the proxy statement is not quite what you wrote. And say, oh yeah, I didn't, So we actually work collaboratively together. It's not like a watchdog, but actually trying to get it right. And then there's review by committee. Certainly for me, recuse from anything that's got to do with personal gain or institutional things. And of course, there are many other people who can do this. And of course, at the end of the day, everything is approved by the Board of Trustees. So here's a little more detail. If you go to the Duke website, and I know that it was during my time that we developed all this stuff over a number of years, that we wanted to be very clear on what those issues are. So there's a statement of policy about financial conflict of interest, the approved management plan, and identification of potential conflict. And here what we do is we use a $5,000 payment as the cutoff point. Right or wrong, but if you look at Harvard and Stanford, where I've been to both places, they're very similar. Most of these places, the conflict policies are pretty much alike. And then, so that is a threshold by which you say, I've got a conflict I need to report, and that's a threshold by which your activities are going to be monitored. And establishment of committees, which is appointed by the dean of the different schools, the provost, and the president, and they are also responsible to approve by faculty committees and others. Procedures of conflict operations, they implement. As I said, we have full-time staff whose job is to support the committee, but to monitor, to look at compliance, and to manage potential conflict of interest. Now, so how did I work in this context? Well, I was on 3 corporate boards. It's actually very interesting because at the time I was just joined Duke. There was no policy about what you can or cannot do corporate boards. So I was recruited, and I came with a number of relationships. And there was a New York Times article which talked about how senior officers of universities have gotten too many of these potential conflicted positions. And I don't know how many people know John Mack, who was at the time, he's a head of Morgan Stanley, came into the board trustees and said, we need to have policy of restricting. So we now restrict only one corporate board for any kind of senior university president, chancellor, or others. I was given an exemption because of my good behavior, but also because of many long relations. So I was on the Medtronic board, I was on the PepsiCo board, I was on Island, which is about tech board. So what do we do in those things? So I follow all the rules of conflict at Duke, so that's highly monitored. But when you work in the corporate boards, I just put this down, I think there are really many really good practices. Now, you can't say that, look, everybody is a bad player or a good player. There are always these issues. But we, as a corporate board, I have to go annually into ethics training. And, you got to pass the exam, until, you know how to do it when you do online training. But we also do, in fact, real training. And, of course, reporting, but also compliance. Always, really, somebody's always making sure that you are in compliance with the policy of the company. Recusal and disclosure. And this last one is really interesting. Because at the end of the day, there's a lot of, I think, misunderstanding about what boards do. Fiduciary boards are boards, certainly in these days, on behalf of shareholders, not on behalf of CEO. Even though some CEOs are chair, and now increasingly CEOs are not chair, and in fact you would have an independent person as chair. If that doesn't happen, you have an independent director who's the lead director. And I was such a position at Genzyme when I was on their board. Our job is actually to watch what the company does. Okay? And in some way, actually, it's not getting cozy with the CEO and with the senior staff. It's actually our role to, on behalf of the shareholders. In other words, my only compensation is the board of directors. Whatever other things I help the company do, I should not receive compensation because my job is actually being the person on behalf of shareholders. Now, we can get into a lot of shareholder issues discussion, but certainly in my own experience, such level balance can be achieved as a member of the board of directors, seeing what's good for society, what's good for the product, and what's good for a company, and what's good for shareholders. Now, in my current job, I step off all corporate boards and all commercial relationship simply because as a National Academy or IOM, where we're really giving advice to a nation and globally, in which our reports and recommendations are going to be used by Congress and policymakers, there couldn't be any perceived conflict, not even real conflict. So you can imagine that whatever we end up doing, if in fact someone feels that I or any of my staff have secondary gains from it or perceived secondary gain, it can be highly criticized. So as I took this job, I stepped off all relationship in the commercial sector. That being said, I feel very comfortable and really welcome the conversation with so many people from different sectors because I think that's the only way we can move our collective agenda forward and our shared vision. And so Patrick knows that I certainly encourage public-private partnership, lots of conversation. We don't paint anybody in one corner or the other. I think by people coming together, that's when you have the real opportunity. And many may or may not know that since I took on as the NAM president, I've created a thing with Kimber Bogart called Innovation Incubation. That was greatly influenced by certainly my experience at the World Economic Forum, where great ideas between 3 and 4 of you can occur, but we need to give you a place to incubate. Because previously at IOM or the National Academies, we're very careful not to get into advocacy or implementation, which means great idea, take it outside and talk it, right? We can be seen as helping. I actually feel quite strongly differently. I feel we should continue to give you the place as the World Economic Forum gave us, but in a way which is more discussion, incubation. creating the strategic plan together. If three of you have a great idea to form an NGO, to form the business plan, to get together everything, and when you're ready, because we can help you facilitate this, then take it outside, like I did with the World Economic Forum, and create a new organization. So that's the background. I hope I've been able to cover some of the things on your mind. I was trying to play a guessing game, but I'm going to stop here and see maybe we can have a conversation. Thank you.